that almost 90% of Indians now have access to safe water in India. So this has been a major, of course, progress over last decades. But we all know that many of those sources are not adequately maintained and therefore do not always necessarily provide access to safe water. Then there is a huge economic cost which these diseases bear. It has been estimated in the World Bank report that almost 6.4% of gross domestic product in 2006 in India has been lost because of inadequate sanitation. This is a huge number. It's billions. It's almost 40 billion United States dollars. So it's a lot of money that could have been used for something else. And that is then topped up with time wasted to access proper sanitation facilities. That is not to have proper roads, proper infrastructure in place. And then some also is added as related to waterborne diseases. So I think that is to say that governments at all levels have to take action to deal with this very challenging situation. The other issue is vaccination. I have already mentioned that young children can be prevented from acquiring any such infections that can develop into chronic forms. And therefore all infants must be reached at their birth and given vaccine. These days it is possible. It is WHO's highly recommended policy, but as you know, we are still missing almost 10 million of children in India out of 26 million born every year with routine vaccination efforts. This time, Indian government has taken it very seriously and is really scaling up its operations and its work, also encouraged by recent success in polio, stopping transmission of polio virus, so that every child can be reached. And then, because Indian government has now included vaccination into routine vaccination scheme, that gives us hope that as routine immunization scheme will expand and reach more children, they will also benefit from having this vaccine. Now the national policy also has to consider how to not only deal with children and newborn babies, but also how to reach to high-risk group, such as people who require blood transfusion, such as father of the 5-year-old kid, such as injected drug users, such as healthcare workers who have to deal with people who are infected with those diseases, because these people also have to be prevented. And then also there are people with, who live with HIV/AIDS, and those also need to be reached and vaccinated. But yet we still have a challenge even to test those risk group people, because we can't reach them, because laboratory facilities are not adequate, because laboratory procedures are not there, because diagnostic kits are not really standardized and accredited and certified, and because there is not enough infrastructure to do that. So this is another challenge which will not be so well understood by common people, but it is definitely understandable in this context of the group I am talking today now. Another challenge is surveillance. So we don't know really all the numbers. We are talking about lots of estimates, but and although hepatitis B is definitely included into the integrated disease surveillance program, which government of India is running with support also of WHO and other partners. And hepatitis A control program is proposed in the 12th plan to be included in this. But we have to be aware that the surveillance is not yet at the level where it should be. And we don't have, therefore, accurate prevalence data for viral hepatitis, which is, of course, linked to the difficulty to access those people who need to be tested. Widespread awareness campaigns is one strategy to make people aware of the dangers and to prevent in their daily life possibility for putting themselves at risk. There is very low level of awareness as per our assessment, and high proportion of the people, because they are even infected but they are asymptomatic and undiagnosed for long periods they enter into developing chronic conditions. So it's very important to know as early as possible that people have been infected. We have all been shocked by the recent large outbreak of hepatitis B in Gujarat state because of use of unsafe syringes. I think this is a glaring example of unethical practices which continue to take place in health facilities. So we need a very robust regulatory framework to ensure that patients' safety is not compromised when they happen to enter the medical facility. Nobody should get infected because of the negligence of the medical personnel. It's extremely important issue to address, and it's an ethical dimension that we often overlook. Now, how do we reach those people that need to be tested? There are a lot of challenges there that need to be overcome, but they are also known for some other diseases, so that has to be dealt with. What I'm trying to say is that we need concerted action of various players such as policy makers, academia, civil society, NGOs, partner agencies, and also, of course, health personnel to increase this awareness and reach a level where people feel people know what they have to do and they do these preventive measures, and that system is well equipped to respond to many individuals who are coming in contact with various health facilities. Now we have to know why prevention is so important here, because although there are medicines that can treat hepatitis, various forms, but these are very expensive diseases, and we are still working on some new drugs that need to be developed for treating those chronic conditions. So because of the costs that are prohibitive to a common man to reach, and because of largely financially unprotected population in many countries, not only in India, but especially in India, of course, people have very limited access to these treatments. So what's the point of having those drugs if we can't treat people with them? So that is another important issue which universal health coverage agenda that Professor Srinath Reddy with his team has so boldly put on the table of the government of India is trying to address. This country deserves better for its people, and therefore it is important that the government takes all the necessary measures to make sure that every child is reached, that those people who need to be tested are tested, those who need to be treated are treated. Because why else you need all either economic growth or any other education or any other development if it does not benefit people? So I think it is a major move that government is taking, and we are all very much supportive of that. Now WHO is working on all of those areas that I have highlighted, so this is last word really that I'm trying to say here. We are working to support the water safety plant development in India. We are working with the water testing, water quality department in India to ensure that those standards are well observed. We are certainly involved in strengthening surveillance system. We are working on routine immunization. We are working on awareness campaigns and many other areas. So what I want to say here, I want to thank all of you who have taken so early already actions in this very important direction, and be assured that WHO backs all your actions very strongly up. I want to personally congratulate Professor Sarin for being so consistent in dealing with this challenge and advancing it step by step, year over year. I think this is really a very impressive movement, and I hope it is really scaling up across the country. So thank you very much. Congratulations to all of us that we are today celebrating this day. Celebrating means that we are celebrating it in a hope that there will be less children infected, and there will be healthier people, and there will be a reduction trend of burden of this very hidden disease in India. Thank you very much.